Good morning, good afternoon, everyone. It is a pleasure to welcome you to this webinar, Tax Systems and Policy. I am Magdalena Sepulveda, the United Nations Research Institute for Social Development Director. We have an hybrid event right now. We have some colleagues here joining us in Geneva at UNRIS, and some of you that are virtually. We have the pleasure to launch the joint publication by the International Institute for Global Health, Tax Justice Network, and UNRIS, titled Tax Systems and Policy, Crucial for Good Health and Good Governance. We're doing this launch at the same time that here in Geneva is taking place the World Health Assembly. This year, the theme is One World for Health. The team try to emphasize global solidarity and equity in health. For those of you who are not in Geneva, it is quite interesting that in this quiet city yesterday, standing outside the UN building, there was a small group of protesters calling the pandemic treaty that they were protesting against the treaty that actually was approved, calling it that it was giving power to global elites. This was a very well-financed group of protesters, very few, quite likely staying in very expensive hotels, and they were there were several buses going around the city with their pancards and everything to seize the negotiation. They are calling that the negotiation, and this is interesting to taxes, that the treaty was an affront to their individual liberties and also an affront to their national sovereignty. Those of us who work promoting taxation for multinational and the super rich are very familiar with both arguments. So it was quite interesting and a major achievement yesterday. So this call for the very importance of this book. There are other major events happening this year for which this book is going to be a very important contribution. As all of you know, it will be the Financing for Development Conference in Seville, Spain, and also the World Summit for Social Development. Both events will focus on how to revitalize social development investment in social services such as health and mobilizing adequate resources to do so. So this is a very timing publication, and we look forward to the discussion. We have a very important group of speakers. I'm going to be introducing them before I ask the questions. But before that, two housekeeping notes. You will have the bottom of question and answer at the bottom of your screen. Please put your question there, and we will be selecting or reading all the questions at the end of the process. And at the end of the webinar, we're going to put a survey that help us to improve our work. So it's very quick, and we will really encourage you to respond to the survey. So I'm going to start first with David McCoy. David is research lead at the United Nations University International Institute for Global Health in Kuala Lumpur and coordinates the Institute program on global health governance, power, and accountability. David, this publication is part of a broader research program on global health, governance, and power. Can you tell us a bit more about the program and its objectives?
Sure. Thank you, Magdalena. So the International Institute for Global Health is a global health think tank. It's based within the UN system, and we have a 5-year strategy with an overarching mission to reduce health inequalities globally. And within that, we have this program of work on power and accountability as it is applied to the system of global health governance. So that's the background. I think before I talk a little bit about this report on tax, I just want to say something about how we've defined global health governance. So we have defined it as the formal and informal structures, institutions, and systems that firstly make decisions about global health standards, priorities, and policies, as well as the system for financing, organizing, and implementing global health programs, initiatives, and plans. And in addition to that, we have described and defined global health governance also as the responsibility of global health actors in engaging with policies and institutions that lie outside of the health sector, but which have a profound or important impact on health. So we're seeing global health governance as something that works within the health sector, but also something that needs to work outside of the health sector. So, for example, looking at systems and institutions related to tax. Now, in our analysis and the development of our program of work, we've been looking at the system of global health governance as it currently exists. And one of the obvious aspects or points about the system of global health governance is that there are power imbalances. There are power imbalances between countries. There are power imbalances between different health issues. There are power imbalances between HIV versus chronic diseases, for example. But there are, in particular, major power imbalances between the public and the private. And in particular, major power imbalances between the public interest and a particular group of excessively powerful private actors. So within our program of work on power and accountability, we're focusing a lot on the issues of powerful private actors and their role, their impact within global health, and the extent to which these powerful private actors are being held accountable. So it's within the remit of this work, looking at power and accountability in the system of global health governance, that we started to look at the issue of tax. And I think what we'll be discussing a little bit more is how is tax relevant to global health governance, and how is it relevant to the issue of powerful private actors who impact on global health governance in a way that undermines the public interest.
Thank you very much, David. And indeed, that's remind me actually for who were financing the yesterday protester, very powerful private actors. Our next speaker is Liz Nelson. Liz is the Director of Advocacy and Research at the Tax Justice Network with a background in human rights, gender, and development. Liz, tax policies and systems have multiple functions, which is labeled in the publication as the 5 Rs. Can you explain their meaning?
Hi, thanks, Magdalena, and thank you to Katia and David who are there, and happy as well to see Bernie on the call. Good morning, good evening, good afternoon, even to everyone joining us online. The tax policies indeed have multiple functions, and for some time the Tax Justice Network has provided a framing of 4 Rs. But here in this space, in this paper, we're talking about 5 Rs. Taken together, we think of them as a social superpower. And I'm going to just run through what the different components are of that social superpower, which we describe in the paper as the 5 Rs. So the first one, revenue, is probably the most familiar to everyone. So using tax as a means of generating national and local revenue, which is critical for governments to create the opportunity to provide public services, public goods, and tailored to the needs of society, and providing also the supporting institutions and infrastructure of legal and administrative systems. So really crucial that we have that revenue. And key about tax is that it's sustainable. It's not a one-off, it's not a 3-year commitment. It could be presented as long-term. The second R is redistribution. Again, I think fairly commonly understood, but important to say that central to taxes supporting redistribution and thereby greater equality across societies is that taxes need to be progressive, and that's obviously really key. So those have the broadest shoulders pay more. So as we describe in the paper, the tax rate should increase as the wealth or the income of an individual or businesses increase. And while progressive wealth and income taxes are effective at reducing social and economic inequalities in society, indirect taxes are often regressive and can reinforce those widening inequalities. So we're talking about there on sales taxes and VAT that disproportionately burden people on low or no incomes. So although progressive taxation is an important mechanism for redistribution, it's also the decisions about how to spend or use public revenue is also important for those equitable social and economic outcomes. The third R is representation, and perhaps the least talked about because its impact is seen over time. And in the paper, we set out how taxation can also, like strengthen democracy, enable good governance by helping to ensure a reasonable and fair distribution of wealth. And critically, with that wealth goes power. And so taxing wealth is really key to address and shift that power imbalance. It fosters, again, we talk about in the paper about egalitarian relationships and social cohesion, and encouraging taxpayers to demand effective and accountable governments is really important. That kind of symbiotic thing. People don't like paying taxes. They have to pay taxes. So they demand something for those taxes. And over time, we can, by making progressive taxes, we can ensure that state citizen relationship is strengthened. And just another point on representation, there's a body of research, not least undertaken by one of our co-authors and my colleague Alex Cobban, is that the contribution that tax systems make to improving governance is strongest when taxes are predominantly direct rather than indirect. And so when states are more reliant on tax for their revenue, rather than external aid, borrowing, or exploitation of natural resources. So it's a really key point when considering how we develop both good health and good governance to address this issue and understand that representation through taxation is really key. The next one, the fourth R, is repricing. And this is about taxes being used to correct market bads or market failures, another way of putting it. So governments can modify market prices in ways that benefit society. For example, taxes can be used to raise the price of commodities and services that are harmful. Tobacco taxes, for example, can also not only raise public revenue, but also increase the cost of a product that is having major social and health costs. Similarly, carbon taxes can be used to correct the failure of market prices to incorporate social and environmental cost of global warming, which again impacts low-income families, no-income families. There's a real gender dimension to that as well, as women and girls are disproportionately affected by the cost of global warming. The final and the fifth are, before I stop talking, is about regulation. So tax systems, they play an indirect role in enabling the regulation of markets and economic activities over and above any effect produced by the repricing. So again, for example, in seeking to collect income and wealth taxes effectively and fairly, governments would need to institute some sort of regulation on banks, on prohibitions on tax evasion, measures to curb tax avoidance. And similarly, in implementing a tax on financial transactions to generate public revenue, governments would have the infrastructure to also regulate and inhibit harmful or destabilizing speculation on stocks and commodities and currencies and so on. So regulation is a really important backstop in those 5 R's. Magdalena, I'll leave it there for now.
Thank you very much, Liz. I'm going to come back to David in the room. In the book, you argue that these 5 R's could be harnessed to better health. How would this work?
Yeah, so these 5 R's provide a foundation for establishing a set of pathways by which we can have better health, but also importantly, reduced health inequalities, which is a major global health goal. And the 3 pathways are, firstly, primarily through the generation of public revenue, we're able to fund effective, efficient public institutions, public services, and public goods. And there's a whole range of these public institutions, goods, and services that contribute to improved health. And here it's really important what we outline in the report, that public services and private services, public finance and private finance are qualitatively different in a whole range of ways. There is something important about having public finance for public goods, services, and institutions that you cannot achieve through private finance. So that's the first pathway. The second pathway is through redistribution. So not only does a reduction in social inequalities produce a reduction in health inequalities, but we also know from a whole range of epidemiological studies that societies with less social inequality are on the whole more healthy than those with extreme or high levels of social inequality. So the reduction of social inequalities in themselves is good for producing better health at the aggregate level. And then thirdly, we see, as Liz has said earlier, that through regulation, through repricing, through reducing the power of harmful commercial practices, tax systems can help reduce the exposure of populations to a whole variety of health hazards. So smoking is one example, but regulation itself is an important mechanism by which we can protect people from being exposed to a range of other health hazards. So those are the 3 pathways by which you go from the 5 R's to better health and reduced health inequalities.
Thank you very much, David. Our next panelist is Katia Uko. Katia is Senior Research Coordinator at ANRIS and the head of our Bonn office. Much of her work focuses on the intersection between social policy and financing. Katia, I'm bringing you into the discussion, asking you, while tax systems are important, why they're not working, and in particular in the Global South countries. What is the problem, Katia?
Thank you, Magdalena. So actually in this paper, what we have done is really to go through the 5 functions of tax systems and tax policies and to see, are these functions actually realized or are they, not fully harnessed? And if that is the case, if we can't see that this function is really working, what are the root causes for this? And so we'll look first of all at the revenue function. And of course, the question is, do our tax systems, of course, together with other financial instruments, do they generate sufficient resources to deliver on the social contract, to deliver on public goods, public services, granting security, welfare, a functioning state, everything that a society needs to function? And And also when we look, from a UN perspective, and also, of course, a member state perspective at the SDGs, do we have enough public and private resources to actually implement the SDGs and reach the targets by 2030, and also increasing and also having enough resources to finance the climate transition. So actually, the numbers show a very sobering picture there. And for example, if we just look at the funding of the SDGs, we now know that actually funding needs have increased. Since 2015, the OECD estimates that this increase is 36% until 22 only. And this is mostly related to the increasing costs of climate change mitigation and adaptation. And the annual financing gap to implement the SDGs by 2030 is now actually estimated at $6.4 trillion. So we are missing $6.4 trillion to actually implement the SDGs. Now, when we look a little bit more in detail, of where the finance is lacking, we see obviously that the financing gap is especially high in low and middle income countries. And at the same time, tax performance is very weak in low and also some middle income countries. And this is the result mostly of a combination of low tax rates and of a low tax base. Now, when we look at the redistributive function of tax, we also see a lot of problems here. And of course, we all know, the figures are well known globally, that inequality has increased. Inequality within countries has specifically increased. We know the figures that 1%, of adults in the world own almost 50% of global wealth, whereas the 50% poorest adults in the world only own 1% of global wealth. We also know that 7 out of 10 people in the world are now living in countries where inequality has increased. So we haven't made huge progress on decreasing inequality through tax policies and other redistributive measures. Rather, what we see is inequality is still one of the most urgent challenges that we face. Now, what is the problem here? How did we come to this? So for one, the tax systems, how they are designed, are not contributing to redistribution. And this has to do with declining corporate tax rates, with tax abuse, especially by transnational companies and ultra-wealthy individuals. For example, the estimated loss of revenue through tax evasion and avoidance is estimated at $500 billion per year. And this is even higher when we consider indirect losses that are due to tax competition. So what we see, especially low-income countries, they want to attract foreign direct investment, they want to attract investors, and they deliberately lower tax rates and provide a lot of tax exemptions just to attract investors. So these losses, are even higher than the direct losses through tax evasion and tax abuse. And finally, when we look at the functions that Liz has outlined just a minute ago, how tax systems can actually contribute to good governance, to repricing, and to regulation. Again, what we see that, to say it, still in a positive way, there's much more that could be done, especially in terms of, strengthening the social contract and governance. We see that we do not have sufficient direct progressive taxation. Regulation could be hugely improved, and also repricing. It does exist, but there is much more potential in there.
Thank you very much, Katja. I'm coming back to you, Liz. Tax Justice Network has analyzed the negative impact of the so-called tax consensus, and this is a topic that is addressed in the publication. So can you tell us what this supposed consensus is and how it is impacting the countries from the Global South?
Yes, sure. Thanks, Magdalena. So this consensus is really fundamental to understanding, I think, the ideology and the mindset behind low tax regimes, and the burden, and if you like, the almost like theft from low income countries of revenue and the opportunity for development and so on. The challenge is both, it's not just low income countries, but the inequalities between countries are impacted on this as well as in countries. And the challenges are great for governments raising sustainable revenue. The tax consensus comes from something called the Washington Consensus, some of you may be familiar with, whose economic policy approach was largely influenced by high-income countries and institutions such as the IMF. And it was expected that all countries followed this tax policy, or this economic policy approach. It has 10 elements, but the third element of the Washington Consensus we refer to as the tax consensus, and it has 3 components. Bear with me, and I'll just quickly run through those because they're important to understand, particularly in relation to the 5 R's that we're talking about. So the first is about the neutrality of creating a neutral tax system, and an expectation in the consensus that we need not to affect tax incentives. And that approach over decades has led to the drive to pursue a kind of liberalization, removal of trade taxes, introduction of indirect taxes like VAT and sales, and which we've talked about how they impact on low income families and or no income families. So minimizing direct taxes on income, on profits, on capital. The second component is about pursuing redistributive goals through expenditure. And again, this is really key to what we're talking about, is that we're assuming that countries, all countries have the revenue to spend. We know that's not true. We know that many low-income countries are burdened by debt servicing and so on, and restricted by tax treaties, etc. So the redistributive goal of the tax consensus is about expenditure, and it's not through taxation. And the third and final part of the tax consensus is that low income, an expectation that low income countries can achieve revenues of between 15 and 20% of GDP, where we know that high income countries typically generate twice that amount. So all elements of the tax consensus really serve to undermine the progressivity of the 5 R's that we've talked about earlier, thwarting opportunities to redistribute by progressive means, i.e. wealth taxes, higher levels of corporate income tax, and by failing to generate tax revenues, the tax consensus denies the opportunity to build strong, effective state making, or for the access to public services that are possible. And by turning away from direct taxes, progressive direct taxes that are likely to strengthen the state and citizen relationship over time, the tax consensus has locked out, for many countries at least, a revenue model that adequately provides critical public services. So to the last part of the question that you posed, Magdalena, is it really consensus? Well, in a way, I think I've sort of answered that, but just to emphasize it, the nature of the tax consensus is and has always been limited to a consensus amongst OECD countries, high-income countries. It has served to drive greater in-country and between countries inequalities. both in high and low and middle income countries. And the damage and the resulting harm is disproportionately largely imposed by high income countries on people in low income countries. There's a whole range of discussion there about the influence of colonialism and taxes. But in terms of this consensus, and that it's not a consensus, I think it's the rationale why we are putting all our efforts and across the tax justice movement into a blueprint and about the fundamental reforms for tax systems under the auspices of the United Nations and the negotiation of a convention on international tax. I mean, Katia has shared some of the figures about the direct revenue lost from because of direct tax avoidance and tax abuse. But it's notable that from some research we did last year on the State of Tax Justice report, 8 countries, high-income countries, were responsible for around 43% of all direct tax abuse. So I think it's not a consensus. It's an approach and a mindset that we need to change that comes from high-income countries from the global north. Thanks, Madalena.
Thank you very much, Liz. Now I'm going to introduce our final panelist, Bernadette O'Hare. She's a reader in global health and the deputy head of the Division of Infections and Global Health in the School of Medicine at the University of St. Andrews, and she co-leads the Government Revenue and Development Estimations Project, the GRADE project. Bernadette, let me bring you into the discussion following Katia's and Liz's explanation. So I would like to ask you, what are the implications of failing tax systems for the social determinants of health and on social spending? We know that you and your colleagues have done some modeling on this question that has produced very interesting data. So if you can share that with us, we will welcome it. Bernadette, the floor is yours.
Thank you very much, Magdalena, and hello to everybody on the call. So the implications of a failing tax system on health and on the determinants of health are very, very significant. And thinking through the 5 R's and the 3 pathways mentioned earlier, inadequate revenue is the most obvious. And if there isn't enough revenue to pay for public services, children don't go to school, they don't use clean water and sanitation, and this results in diarrhea, recurrent episodes of going to hospital, which can often lead to malnutrition, etc. Other ways that failing tax systems and inadequate revenue means that the infrastructure is weak. People don't have access to electricity. They don't use clean fuels to cook, which can result in indoor air pollution and respiratory diseases. So the revenue aspect has very significant implications. And indeed, public services is probably one of the most efficient ways or effective ways to reduce inequality in our societies. And failing tax systems means that redistribution is not as effective as it could be. And if there isn't enough revenue, governments can't provide social protection for those who need it most. And social protection, we know, can reduce or even eradicate poverty, and this could reduce a vast amount of premature mortality and morbidity. The other thing that we've heard mentioned is public services strengthens the state and citizen relationship, whereas failing tax systems weakens this relationship because the public don't see what they're getting for their tax. It also reduces tax morale. They're less likely to want to pay taxes to support public services. Finally, we've heard a little bit about regulation and repricing, and if governments don't have the ability to regulate and reprice, this means that they are unable to regulate unhealthy products such as tobacco and unhealthy food, etc. And these products are driving an epidemic of non-communicable diseases. And so, for example, cardiovascular disease and cancer and diabetes. And these diseases, non-communicable diseases, are killing millions of people every year, most of which live in the global south. So as a result of failing tax systems, the healthcare system, which needs to deal with these non-communicable diseases, is also failing. It's been undermined. So people are getting more non-communicable diseases, but the health systems to deal with them isn't available, or is weaker than it could be. So furthermore, failing tax systems also drives debt. And this, in combination with loss and damage due to climate change, amplifies the effect massively. And often, as we know, debt is, if countries need assistance with financial assistance, this often comes with advice or conditions which further undermine health. So, for example, governments may be advised to put a ceiling on healthcare expenditure, or to cut public sector wage bills, or even to privatise public services. And as we've heard, public services are better than private services when they're well managed and well run. They have improved outcomes. At the household level, advice sometimes is to cut social protection or to cut pensions, and all of this will impact health, the determinants of health, and therefore health. So, and thank you for your question, Magdalene. Yeah, yes, we have done some modelling on to try and answer these questions, and we call it the Government Revenue and Development Estimations GRADE, and it's at the University of St Andrews in Leicester. And the reason we established the GRADE was to translate these big numbers. We've heard some big numbers, but really we need to know, what does this mean to people's lives? And the GRADE is built on a large econometric model, and it's also in the form of an online tool which can allow users to have a look to see if, for example, their country is losing lots of tax revenue or debt service, or if indeed a company is paying fair and transparent taxes. How could this impact people's lives? How could it impact the determinants of health? And remembering that the determinants of health are also human rights, and they're among the SDGs. So it can be used for lots of revenue outflows, and it can be framed in lots of different ways, which might be useful for policymakers or for advocates. And the one thing that I want to point out about the tool is that it's built on an econometric model between revenue and the outcomes that I've mentioned: water, sanitation, education, etc. But it also critically incorporates the worldwide governance indicators into the model. And this means that it's unique for each country. So the estimations are very realistic at the country level. And it also assumes that governments have spent money in the way they have done over, the last 30 years or so, and that they don't suddenly reallocate any additional revenue they have to a given sector. So if anyone, we're actually having a webinar next on the 18th of June, and this is in collaboration with the Trust, Accountability and Inclusion Collaborative, and with the University of Leicester and St Andrews. Would like to invite you to the webinar if you're interested, and we'll put a link into the chat. If you want to learn more about the tool, or maybe how you might use it, or give us some feedback on it, it'd be very welcome. So thank you, Magdalena.
Thank you very much, Bernadette, and please share the link with the audience so people can join that other webinar. So we have heard of the 5R pathway, and very broadly that without taxes, we don't have public services and investment in social protection, and we have weaker health. So let's now move to the solutions. And with that, I'm moving to Katia. Katia, AmRest has recently published a proposal on how to improve tax policy and international tax governance. What are the recommendations of that publication?
Yeah, thank you, Magdalena. So while AmRest has been working on this issue over the last couple of years, I actually want to say that, much of the conclusions and concrete policy measures that we need to take are, coincide with what we have identified in our author group for this particular report. So I will just very briefly, tell you about like the 5 key recommendations that we are suggesting in order to make tax systems and tax policy a much more powerful instrument for social development, for access to health, for human rights, and for the Sustainable Development Goals. And of course, the first very important recommendation is that we need to replace this tax consensus, which is actually not a consensus, with a very ambitious proposal for creating progressive tax systems. And it is especially important that low and middle income countries raise the level of their tax revenues and also make their systems much more progressive. As we have heard, for the moment being, many of the tax systems in the global south rely heavily on indirect taxes, and these are not as effective for the social contract, for governance, for accountability, and also for raising sufficient revenues compared to more progressive systems. There are also a lot of interesting proposals on the table, and we really join forces there with other actors who are promoting new tax systems. It is important to tax ultra wealthy individuals and transnational corporations, to introduce wealth taxes, but also to kind of backstop these measures at the global level, for example, through the introduction of a global billionaires tax, which was a proposal that was put forward by the G20 presidency of Brazil. We know there are only 3,000 billionaires in the world. Nevertheless, a very low tax on their fortune would already produce a very significant income to address the global challenges we are facing. There are also a couple of regulative and administrative measures that would support the implementation of progressive tax systems and, reducing illicit financial flows, reducing tax abuse, such as the public registers of ultimate beneficial owners of companies or global asset registers, country by country reporting, exchange of information, etc. It's also important to not see the tax discussion isolated and different from, a kind of a different economic development model that we are promoting. So, if it would be possible actually to move away from our current economic model and have, economic policies that actually create employment, that, basically reward reproductive work, that, protect the environment, then we would also have, less harm produced, less problems to fix, and more revenues to dispose of. The second important recommendation that we have is that we need a new international tax regime. The very promising development at the moment are the negotiations around the UN Framework Convention on International Tax Cooperation. We have the terms of reference, the full negotiations already commenced. And, a lot of actors see this as a once-in-a-century opportunity to really change global tax governance. Third, we don't want to wait just for this new convention to get into force. Countries can already adopt unilateral measures to protect themselves from cross-border tax abuse. So a lot can be done at the national level as well. Fourth, improving the tax systems needs to go hand in hand with financial reforms, especially to address the problem of debt distress and illegitimate debt burdens. So we need debt cancellation and also much more equitable and increased access to concessional finance. And finally, we have deep inequalities, not only within countries, but also between countries. These are, as Liz already mentioned, much rooted also in historical legacies, in extractive models, in colonialism and imperialism. And so we need also a policy of reparations, of loss and damage, for example, of transfers from north to south that are much more funded to countries in the global north.
Thank you very much, Katia, for this comprehensive view, really saying that we should all be concerned with tax system or the way in which they are failing us. So before we open for questions from the audience, I'm going to come back to you, David. I hope that in the webinar there are many participants from the health community. Certainly here in Geneva this week and next week, there are many representatives of the health community. So what is your key message to them?
So the key message, I think, to the global health community, it's the community of people working in public health also at the national level, is to really see and understand tax policy and systems as possibly, and in my view, is the most important public policy instrument for improving health and reducing health inequalities. It is, as Liz described, a social superpower. It is a means by which we address and fix a whole range of health problems and health challenges. And yet, despite the importance of the 5 Rs, despite the clear evidence showing that health can be improved through those 3 pathways, tax policy and systems is largely neglected in global health. Most of the conversation is around the use of tax on tobacco or on certain harmful commodities, but the understanding of tax as a social and economic institution is hardly ever discussed in global health. In fact, if you look at the agenda of the World Health Assembly this year, you'll see, in fact, that there are huge amounts of conversations happening about how we fill the public financing gap with private investment. So the conversation about how we strengthen and improve public revenue is being dwarfed by the kind of rush towards trying to fill the gap by bringing in more private finance capital into the health sector. And this, of course, will have many disastrous consequences. The least of all, we don't have the regulatory systems to be able to ensure that this private investment will not cause more harm than good. The other thing, of course, that we're doing in global health is legitimizing the systematic tax abuse that is going on. So we are looking to the very actors that are undermining public institutions and services, looking to them for solutions, looking to billionaires for solutions, effectively legitimizing and endorsing a whole range of actors who perform tax evasion and aggressive tax avoidance on a regular basis. So we really need to change the mindset, I think, within global health and within public health more generally, to start looking at tax systems and policy from a clearer political economy lens, and understanding how we not only fix the systems that are causing health problems, but that we don't actually inadvertently reinforce the problems by relying on people that are, to some extent, causing the problems in the first place.
Thank you very much. David, I will remind to the audience that they have the question and answer chat. We have several questions now, and I got some help in selecting them. So, and I have them here in front of you. So the first question that I will going to pose to the panelists is that lower and middle income countries often struggle to shift to a more progressive tax systems because they're more difficult to administer with their often limited resources. This is the question. So how do we solve this chicken and egg problem? Who would like to come first from the panelists? So how we can help developing countries to improve their progressiveness in their taxes? Liz.
Hi, yeah, I think we've already talked about this, and there's no overnight solution. But I think for lower the instrument we've been talking about, I think Katya's mentioned it, and other panelists, which is trying to take a new approach under the auspices of the United Nations for a UN framework on international tax. And that's, although you are asking specifically about countries and low-income countries, that framework, that negotiation that we're embarking on, or governments around the world are embarking on, is really key to taking the stranglehold off low-income countries. And by freeing up their, if you like, their taxing rights, their sovereignty, to do things nationally that they're able to do. And part of that, the chicken and egg part is, you need an effective revenue authority to both monitor and regulate and the tax collection and follow through what businesses and wealth is doing in terms of tax abuse. So all those things are important, but you need revenue for that. So there is a chicken and egg thing, but I do think that low-income countries are very aware, and actually the African region and African leadership has been absolutely key in pushing for this, if you like, blueprint change on global tax, which can, if you like, release the opportunity and the opportunities to have more revenue locally, and therefore to deal with the with in-country revenue generation. It doesn't take away the complexity of tax. I mean, the tax rules are complex, but I think what we need to do is try and get to where countries can respond and when they can have a revenue authority that's on the game, if you like, and where they can push for progressive taxes.
Thank you very much, Liz, also for emphasizing that it is not only a national tax system that is in place, but the global tax system. Lower and middle income countries cannot change it alone, and that is why the UN Tax Convention that is under negotiation, that was mentioned by Liz and Katya, it's very important. It has been pushed forward through the African Union group, the African countries, and supported mainly by the developing countries. So it's a very important process that should end in 2027. We have another very difficult question, I would say. I'm going to try to interpret the question, but it's a question about governance. So most of you have talked about governance, and David, you has also mentioned the importance of making and Kathy as well, the super rich to pay. So the question is, how can we do that when they are the one influencing the policies because they have power and money, and we have a free market system that is the norm? So what can we do to really change the system? You can start.
Okay, well, I mean, going back to what Liz has said, there's no overnight solution for this, but clearly, countering plutocratic and oligarchic power is an important element of making these reforms happen. And that requires social mobilization. That requires people standing up and working with and through their governments, working to make sure that the governments are serving the public interest. And this is a political challenge. It's not a technical or technocratic challenge. And so we have to engage through the political process. We have to mobilize the public with evidence, with information, enable them, empower them with knowledge and understanding. And I want to come back to this issue also for the global health community in particular. We need to be thinking about delegitimizing the actors that are preventing reform from happening. And this includes not just the elites and the corporations that are practicing tax abuse, but the banks that are part of the system, the accountancy firms that are part of the systems, the big global consulting firms that are part of the system. We are constantly working with them on a daily basis, and thereby legitimizing this entire structure of tax abuse. And so we can't have it both ways. Yeah, and I think this is going to be an important element of the political struggle for reform, is calling out those actors that are part of the problem, and finding a way for stopping these actors who we accept as being part of the mainstream, finding ways for them to stop causing harm through structural violence.
Thank you very much. Somebody else would like to add to that, or we have several questions. Katja.
Yeah, maybe just very quickly agreeing with what David just said. I think, we often talk in UNRWA, where we work a lot with the concept of a social contract, or that we need actually an ecological social contract. We say we have to bring in elites back into the social contract. And of course, that is a combination of, in a way, carrots and sticks, but it's also changing the economic model that creates the huge inequalities in the first place. So it needs political action, it needs strong regulation, strong governments, strong civil society. But the problem could also be much less extreme if we would have an economic system that would have more egalitarian outcomes, and would not produce these very powerful, rich, ultra-rich people in the first place. And I think the fact that we are in a very complicated situation at the moment is just the result of the last 4 decades of continuously transferring power from the public to some powerful private actors, as you say, which then also, of course, come into the political process and then reproduce, these inequalities. So we need to act on the political front, but we also need to change the economic system that actually produces these extreme wealth and income inequalities.
Thank you, Katja. And indeed, I mean, we are living a very difficult time of state capture. So these policies are very difficult to implement. I'm going to mix two questions here, but the audience is interested in examples on taxes that can improve health. Like there's been some mention about tobacco and sugar. If any of you can develop a little bit more on that. And there is also another question, that how can environmental taxation framework at the national level could also bring positive health outcomes or improving governance quality. So anybody would like to start? Or select part of the two? I mean, it is already a mix of questions, so feel free to answer partially as well.
So let me talk about tobacco and sugar taxes, because there have been many examples where these taxes have been implemented and have produced positive health outcomes. But I'm also keen that we don't talk about tobacco and sugar, and that we talk about the biggest systemic and structural issues. And perhaps the evidence and the data that I would most like people in public health to look at is the work done by people like Richard Wilkinson and Kate Pickett to demonstrate the relationship between inequality and overall health at an aggregate level. And it's understanding the processes and mechanisms by which more egalitarian societies produce healthier societies. And it's done through all these different pathways that we've already talked about. So while I think taxes on tobacco, taxes on ultra-processed foods and various other harmful commodities are important, I think at this present juncture, they've also become a distraction from some of the more important tax debates and discussions that we need to be having in global health.
Thank you very much, David. We're going to end with that, just to tell the audience that we're going to disseminate the questions to the panelists, so they have the chance to read them directly and not through my interpretation of the questions. I would like to thank you all, and thank you to the 4 panelists and to the all participants. We will be continue to providing information, and if you go to the ANRIS website, you can also download the publication that we launched today. Thank you very much to all for your participation.
Thanks.